Well, welcome back. It is still Saturday, the 4th of April, the 4th of the 4th, 2020. Now, starting off with the United States today, we see there's a great increase in the number of cases in the United States. And these are confirmed cases, and there's two reasons for this. The first is the amount of people infected in the United States is going up steeply, very steeply. So there is an increase in cases. But also we're seeing more cases here in the confirmed column, in this confirmed number, because of increased testing in the United States, which is good. But of course it's still nowhere near where we'd like it to be or where it needs to be. And I'm sure maybe, like me, you've seen these pictures of people queuing up outside hospitals in New York for hours. People who are ill, they're feeling the symptoms, and yet they're having to wait in the cold and the rain for several hours. More than 5 hours, I think, today for some cases to be tested. So it's not good for them queuing up there in the cold, but yet that's what's happening. So cases are increasing in the States and more cases are being detected. New York State, more than 500 deaths today, 3,000 plus cases. New York City and New York State, a bit of an epicenter for the COVID-19 in the United States, but increasing cases in Michigan, Massachusetts, Louisiana, New Orleans, a very dramatic increase in cases in New Orleans after the Mardi Gras, only just over a month ago, when there's a lot of people congregating together and the virus would spread then, I have no doubt. But increasing cases also in New Jersey, South Florida. Now, I was just bemused to learn this morning. In Texas, churches are allowed to open. Now, I do hope no one's going to them. I do hope no one in Texas is as irresponsible as to go into a church meeting with other people. I do hope not. But distressing that they are still allowed. This is what happened in other countries. People were going to churches, people were going to shrines in Iran, spreading the disease. People should not be going to church because there's lots and lots of churches online. I'm sure your own church is online if you live in Texas. You don't need to physically go for a period of time. Florida and Arizona, the golf courses are still open. Now in Florida, this is hard. This is really... Florida and Arizona, golf courses are considered essential services. Go figure. I mean... People are dying in large numbers in the United States, and golf courses are considered essential services. Let me just say, I do not consider playing golf to be essential, and I do not consider a golf course to be an essential service. That really beggars credulity. So Florida and Arizona, get your act together on the golf. Just not on. Seriously not on. People are dying here. I'm getting angry. Centre for Disease Control advice, mouth and nose covering. Now this is new and very interesting. So the Centre for Disease Control is now saying that it advises mouth and nose covering, but not with medical masks, because it wants to leave those available for professionals to use in the healthcare situation. So it's saying make your own masks. So that's the Centre for Disease Control. They are the experts in the United States. Now, Dr. Fauci, who's become one of the faces of this pandemic, I must say, albeit he works in very difficult circumstances, often in very difficult company. But he's talking a lot of sense. And he's saying asymptomatic people can spread the virus by speaking. Now, a couple of things to say there. This is the graph we looked at in the last video. So what he's saying is that people that are asymptomatic or pre-symptomatic, before they have symptoms or without symptoms, are infectious in this period here. So that's day one, when someone starts to feel ill. So before here, in this time, the person does not feel ill. After this time, the person does feel ill. And often for a couple of weeks after that, for some time after that as well. I'm talking to a friend today who's now in day 10, who still feels pretty bad and still got a fever. And in fact, we know that most complications occur in the second week. In fact, day 10 is probably the most critical time for the development of complications. But what Dr. Fauci is saying, yes, people are infectious when they are feeling healthy before day one when they first get the symptoms. So he said that clearly, and he's absolutely right. So asymptomatic people, A just means without. So without symptoms, people without symptoms can spread the virus by speaking. Now, what interested me today is Dr. Fauci used the A word. I heard him unambiguously say aerosolization. So what this means is he's happy, well, not happy, I'm sure he's distressed, but he's satisfied now that you could be talking to someone as I'm talking to you now. Fortunately, we're separated by the internet, but if I was infectious now, I could be giving off viruses just in my speech because of aerosolization. And we've looked at previous studies that said aerosolized virus can stay in the air for some time, probably hours. So don't be with other people talking to them, especially don't be close to anyone talking to them whether you're outside or not, and especially not inside. We don't want to be in confined, stuffy places. So what Dr. Fauci is saying is that the masks are to protect others from me. So I'm wearing a mask to protect you rather than to protect myself. You are wearing a mask to protect me because you might be infectious. Therefore, I don't want to catch it. So if you're wearing a mask, you're less likely to infect me via speech and aerosolization, small particles of the virus that can hang in the air. And I want to support Dr. Fauci and the American Centre for Disease Control 100% on this. This makes perfect sense that we wear a mask to protect others. Certainly during close transactions, although they should be at least 2 metres away. All the more dangerous inside in poorly ventilated areas. Now, Dr. Fauci is also saying clean objects and door handles. Now, I'm a bit concerned, I must say, about people spraying huge amounts of chemicals all over the streets. I don't really know of any evidence for that. But certainly the targeted cleaning of things like your mobile phone, your door handles, things that could become infected, is a very good idea. And Dr. Fauci personally washes his hands 50 times a day. And when he can't wash his hands, he uses hand sanitizers. So that's good enough for me. And he said all should stay at home. And he's talking about the United States. So he's the lead doctor if you're in the United States. And he's saying you should stay at home. You can't order it. I think he'd probably like to, but, well, shouldn't say what he's thinking. And Dr. Fauci says risk of outbreak anywhere in the country. So let's be clear. He's saying there's a risk of outbreaks anywhere in the United States. Therefore, all people, not just in infected areas, should be physically separated. All states are involved in this physical separation, even if there's only a few cases now. And then he said this will change. In other words, he believes that this infection is going to spread to, well, it's already in all states, but he believes it's going to carry on being transmitted, from what I could tell, in all states. And that does seem likely. So if you're in the United States, I'm afraid it's likely that there will be community transmission in every state. Start acting as if that is the case now would be my advice, and Dr. Fauci's advice, and I think anyone's advice, if you want to prevent the spread of this condition and thereby save lives. Now, the aircraft carrier, is it the Franklin Roosevelt? I think 137 positive sailors on that. Now, these will be young, fit men and women. I do hope they all make a good recovery, and if any of them are watching, they have my best wishes and the best wishes of everyone. Yeah. Get well, guys. Australia. Now, Australia's interesting. 5,500 cases, but a great decrease in the number of new cases. So if we look at the Australia graph, and that's cases, and that's time, Then what's happening in Australia is, of course, the number of cases are increasing, but less so, the total number of cases. But the number of new cases is actually already going down. So the number of new cases in Australia is decreasing, which of course is remarkably encouraging. Now, of course, as that carries on going down, this line will increase a bit. So what I'm hoping is going to happen in Australia is that line will flatten off and stop increasing, then flatten off. And I'm hoping that this is going to go down because things seem to be going reasonably well. So let's hope it goes down. It probably won't go down quickly, but let's hope it goes down quickly. So that is encouraging for the Australian situation, a decrease in number of new cases. Most cases are acquired overseas, particularly from Europe, America and at sea. Now, Australia made big slip-ups in the early stages by letting people from cruise ships disembark. So I think people from cruise ships represent a third of the cases in Australia. These cruise ships have been nothing but a nuisance since the start of this pandemic. All sorts of trouble with cruise ships, as we've seen on quite a few reports. People getting on cruises at points in time where I wouldn't have got on a cruise anyway. So most cases are acquired overseas, Europe, America and at sea. So what they're saying is there's little community transmission in Australia. So it looks like they must be isolating their cases, which is brilliant. They've done quite a few tests. Now, a lot of the cases are in the bottom right-hand corner. New South Wales, Victoria, in other words, in the southeast of the country. Queensland up in the northeast there, 900 cases. But Western Australia, many fewer cases, which is good. Now, the fly-in, fly-out, the FIFO periods are extended to reduce. A lot of people in Australia, well, certainly in Perth in Western Australia, they fly out to the desert and they dig up iron ore for a couple of weeks, then they fly home again. It's called fly-in, fly-out, and those periods are extended now, so there's less flying, which is good. Which is good anyway. It just means they're away from home maybe for a month instead of 2 weeks. A stage 2 lockdown in most places. Now, just to briefly say what this means in the Australian situation. Public gatherings a maximum of 2 people. Weddings a maximum of 5. Funerals a maximum of 10. People advised to stay home unless you were shopping for essentials, receiving medical care, exercising or travelling to work, or in some cases education. Parks are closed, restaurants and cafes are takeaway only. I'm assuming all pubs are shut. Retail stores, hairdressers still open. Now, this is what I've been emailed. Now, if this is true, I'm very uncomfortable with this because hairdressing is a pretty close-up activity. Not ideal, I wouldn't. Well, it's certainly not ideal. It's close. It's not 2 meters, is it? Obviously, it's not 2 meters. You can't cut someone's hair from 2 meters away. So, to me, not acceptable. Children should be kept at home unless they need to go to school because they have parents who are essential workers. And then the shielding, people aged over 70, age over 65 with pre-existing conditions, or Indigenous people aged over 50. Indigenous Australians do have a lot of conditions like diabetes and things which would increase their level of risk, I would expect. So aged over 50 with pre-existing conditions should stay at home wherever possible. All makes sense. I'm not sure about the hairdressing, but the numbers are looking promising in Australia, so that's encouraging. Now the UK, we've got way more than that, times 10, times 20 that. Way more. Big increase in deaths. And unfortunately, we did predict this a week ago. We knew this time last week that there would be a great increase in deaths this week in the UK. And they will carry on increasing for some days to come, I am afraid. We know this is going to happen because of the lag periods. Nightingale Hospitals, as we're calling them, are opening all over the country. These are emergency hospitals usually set up in exhibition centres, and some amazing places have been set up in 9 days. I'm quite impressed actually. the level of organisation that's come about in 9 days to set up that hospital in London is exceptional. Absolutely exceptional piece of work. Now, this is concerning. A care home near Glasgow, 13 out of 90 of the residents died last week. They were treated in the home by the GP. They weren't taken to hospital and they weren't tested. But 2 of the care staff have been tested and been found to be positive. So this is exactly the sort of thing we saw in where was it? King County in near Seattle, when we looked at that study last week of the devastating effect that this virus can have amongst older people living in relatively close confinement, often with comorbidities. This was anticipated that this would be a problem, and sadly it's manifesting as a problem. So that's quite a proportion of the total number of people living at this facility that died last week. 13 deaths out of 90 in a week. Now, the government have ordered 3.5 million antibody tests. We've looked at the difference between the antibody and the antigen test before several times. They've ordered millions of those, but they're not quite sure how well they're going to work. And apparently some tests are giving false negatives. Now, a false negative means that someone who is actually positive tests negative. So they're not really negative, they're actually positive, but it reads negative. So it's a false negative. And that actually is very concerning, because you could test someone and say, well, you're negative, off you go, back to work, and yet they could still be infectious. So that's quite concerning. So senior doctors are in the UK now are advising doctors to judge by the clinical diagnosis. The clinical features of this condition are now well recognised. We've looked at them many times. The fever, the shortness of breath that can develop, the myalgia, the painful muscles, the dry cough. Very often, in many cases, especially in younger people, the loss of smell, the loss of taste. So to diagnose it from the symptoms and in the context, if someone's been into contact with cases especially, then some doctors are urging current clinical diagnosis rather than relying on the testing. But the testing will get its act together. It will. It's coming. We need testing. Apparently millions of antibody tests are coming, so we've got an option apparently in the UK on 10 million of these, which of course we need. We need to test people. Now there is implications here, because if people are testing, suppose we had millions of antibody tests and we test 1 million people and they're positive, that means they've had the virus and therefore immune, then they're going to have to behave differently to people that haven't had the virus and are not immune. So there's going to have to be some way to differentiate them. Now, I get a lot of, let's just say, robust emails about social tracking, but I can't see any way around. There's going to have to be some way that we can differentiate between people that are immune and people that aren't immune. Hard to see any way around that, because the testing and the herd immunity and eventually the vaccination are our exit strategy from this lockdown that we're in. 2,000 prisoners have been released early, people that were due for release shortly. Prisons, of course, I've been worried about from the start. We've seen prison trouble, prison infections in China, in Iran, and other places where there's been trouble in prisons because of the risk of rapid spread in institutions. Now, the UK can peak in 10 days' time, or it can choose to peak later if it wants. What do we mean here? Well, if everyone obeys all the rules and we stay home this weekend, then we could be reaching the peak number of new infections in 10 days and the peak number of deaths probably a week or two after that. In fact, I would hope this could be the peak in deaths even in 10 days, because the delay of 2 to 3 weeks, we've already been in lockdown, already in the second week. So let's hope we choose to peak in 10 days, not in 6 weeks' time, by going out. And then when we've peaked, so in other words, we're still going up now, we want to peak and level out in 10 days' time. So we're hoping that in 10 days' time, that's the 14th of April, the UK will be at the peak and we will then plateau if everyone behaves themselves and social distances. If we don't, then it will go on climbing for longer and the peak will be higher, and who knows where it will go after that. So this is with good social control like we have now for the most part. This is if people start breaking the rules and start spreading around. So that's why we've been ordered to stay at home in the UK. And then hopefully this peak would start to fall down quite quickly. And I believe it can do, because with the social distancing we now have, the R0 should be less than 1. Therefore, the number of new cases will reduce, and there's some encouraging signs on that already. New hospital admissions should reduce, and then deaths should reduce. Globally, as I've said in the last video, I'm more pessimistic. I think global cases are going to go on rising for some reasons we'll see in a minute. Now, Turkey. Obviously more cases than that. 425 deaths reported. Increasing cases in Turkey. It tripled in the last 7 days. So this is concerning. So Turkey is very much on this increase slope here. If the number of cases tripled in 7 days, that is a rapid rate of growth. And the epicenter is Istanbul. We now know that Istanbul is the epicenter. Istanbul has 16 million people. 2 million people are still knocking around on the streets. That's too many. That means there'll almost certainly be more spread. There's a curfew for over 65, so there's shielding here. But 2 million people still walking around the streets means that I would expect more spread in Istanbul. Istanbul as an epicenter will carry on growing, and of course from there it can spread all around the rest of Turkey. Now, bazaars, cafes, schools, sports facilities, mosques closed. Good. All international flights stopped. Also good. Italy, we believe, appalling figures. This total number of cases, total number of deaths. In Italy, that's the number of deaths, 14,681. But encouraging signs that Italy has peaked, because the number of deaths is now going down. There's still many hundreds a day, but the number is going down. So it looks like the lockdown measures are starting to take effect in Italy. And likewise Spain. Now, increasing number of deaths, another 804 deaths in the last 24 hours, making 11,700 deaths. This is an appalling number, but it's less than the day before. And that's less than the day before. So that's the second day on the trot now that the deaths in Spain have started to reduce, albeit at an appallingly high level. They are starting to go down. So hoping that means Spain's new cases have peaked already a week or two ago. And if the deaths have started to decrease, that means less people got the disease about 2-3 weeks ago as an effect of the lockdown. So I know it still sounds bad, but that's actually encouraging, because deaths are the last thing to go down because of the lag effect. More cases, but as I said, a reduction in the number of new cases. And the lockdown extended to the 24th of April. So it started on the 14th of March and it's now being extended to the 24th of April in Spain. Now, just to finish off, long report today, but France, cases and deaths still increasing. So whereas Italy and Spain, I'm very hopeful they have peaked, France does not seem to have peaked, certainly in terms of deaths. So I'm hopeful that in France the number of new cases is going down, but sadly still seeing an increase in the number of deaths in France, so not at that peak yet. Tough enforcement measures. So it could be at the peak for new cases, but certainly not the peak for deaths because of this 2, 3, 4 week lag. Now, India I've mentioned African countries in the last video. India, I'm very concerned for India. That's the official number of cases. It's a meaningless number of deaths, so these numbers don't mean too much. But I heard reports today that the number of cases in India are doubling every 3 days. That is very, very concerning. And we still see videos every day of people in crowded conditions, where if the disease is present, the spread is essentially guaranteed. India has 11 ventilators per million people, and even then, healthcare in India is not good at the best of times for most people. 1.3 billion people at risk in India, and my anxiety levels are high. From a history, we remember that over 18 million people died in 1918, 1919. Let's hope the numbers this time are nothing like that. But 1% of 1.3 billion people is a lot of people. It's a very, very concerning situation. And the limited health facility in India can be overwhelmed potentially fairly soon, meaning that the case fatality rate has the potential to rise significantly. So what's the sort of takeaway message today? Well, I think what we're seeing is cases starting to be controlled in countries with effective government and effective lockdown. Italy and Spain, we're starting to see indications that we might be past the peak, certainly past the peak in new cases. What's less clear is the exit strategy from the lockdown. So what we need to get out of this lockdown is huge amounts of testing to identify, isolate, quarantine contacts and focus on people that are infected. So we need massive testing for those infected. We need massive antibody testing so we can say who's had the disease and therefore we believe is immune, who can be returned to normal duties. And we're going to need some way to differentiate between those people. I don't see any way around this. I'm uncomfortable with the civil rights and implications of this, but I really don't see any way around it. People are probably going to need a certificate to say they're immune, therefore they can return to normal duties. Whether that's a piece of paper or whether it's on the phone. And I know a lot of you are severely worried about that. But I really don't see any way around it. So don't write to me hating me for saying that. Suggest something better. Suggest another way to do it. The other thing we're seeing is increasing cases in all the poor countries of the world, as we've anticipated since India, tragically. I feel we're going to carry on seeing more increasing cases in poor countries of the world, that the global figures are going to go up. But I'm hopeful that we can start containing it in a lot of Western countries. I'm quite concerned about the United States. And I do hope those people in Arizona and Florida enjoy their round of golf.